to On My Mama, Addressing the Black Maternal Health Crisis. I'm your host, Sister Akila. Today's episode takes a look at the recent trend of hospital closures and what that means for us and what our options are as birthing women during a maternal health crisis. Let's start. I want to start today by bringing up an article that I recently came across that was entitled 88 Hospitals Closing Departments or Ending Services. Now, this article was written by a Mr. Andrew Cass, December 26, 2023, so just about 2 weeks ago now. The article states, quote, "A number of healthcare organizations have recently closed medical departments or ended services at facilities to shore up finances, focus on more in-demand services, or address staffing shortages," end quote. So of course, I scroll down to read through the list, and I find several maternity wards and labor and delivery departments that have either closed or announced their closing. Now, as a critical thinker, I instantly have a question. How are hospital maternity units being allowed to close during a nationwide maternal health crisis? And then, follow-up question, what demographic do these closing hospitals serve? And how do these closures affect Black communities and the Black maternal health crisis in particular? Okay, so after some digging, I found that several of the maternal hospitals that closed served a large Black population. One hospital was closing because of the loss of a patient there. Makes sense, right? Most of the closures that have been publicized or reported on in the local news, and they had received great criticism and protest from the members of the communities they served. Now, keep in mind, the majority of the hospitals were not closing altogether, but they were only closing their maternity departments, leaving women of childbearing age with only family doctors in the area, especially in rural areas, okay? So this brings me to the next article that I read entitled, quote, "Can family doctors deliver rural America from its maternal health crisis?" End quote. Now stick with me because I'm gonna tie everything up in a minute here. This second article was written by Sarah Jane Tribble, January 3rd, 2024, so just last week. The article reads, quote, "In July, the Department of Health and Human Services announced a nearly $11 million investment in new rural programs, including family medicine residencies that focus on obstetrical training." End quote. Obstetrics is the area of medicine that focuses on pregnancy and childbirth. So I said, let me find the HHS press release and read it for myself, because maybe, which is the result of all the attention that, and press that things get, is really starting to flow toward resolving the crisis, right? Now we're actually going to put our money where our mouth is. So I find the press release, and it talks about how nearly $11 million was awarded to 15 awardees, and 3 of those 15 awards, quote, "will be used specifically to develop new family medicine residency programs with enhanced obstetrical training in rural communities," end quote. So I do a little math, and 3 out of 15 is about 20%. If maternity wards and hospitals are closing literally from California to Connecticut during a maternal health crisis, 20% of $11 million is nowhere near enough to actually be the solution to the crisis, right? So I said, okay, maybe that $2.2 million is a part of a multi-strategy approach. You know how they're like, oh, we're going to take a multi-pronged approach to this crisis. So I said, okay, well, let me see what other organizations or what other innovations are being funded. How much funding is going toward midwives and birth centers as alternatives to hospitals, seeing as how hospitals are closing? I found 2 lonely bills, y'all. One for midwives, HR Bill 3768, and one for studying birth centers. So not even funding birth centers, but studying them. And that was HR 5189. And neither one of these bills have had any change in their status since they were introduced as legislation, okay? And one of them was introduced way back in 2019, which is almost 5 years ago now. So the money is not flowing. Well, why am I sharing this, right? Why is this important? I'm so glad you asked. With even less access to hospital care, we've got to become more self-reliant. Now, hold up. I'm not saying you're going to eat nuts and berries in the middle of a forest and go have your baby in the field somewhere. That's not what I'm advocating, okay? I am saying that we've got to develop our ability to reason, and we have to rely on that reason and change our behaviors in a way that benefits us, okay? Now, I really want you to take a moment and think about what I'm saying for yourself and see if it makes sense. In the middle of a nationwide maternal health crisis, states are actually approving the closures of maternity departments and hospitals. Do those sound like the actions of people who actually want to put an end to this crisis? That don't make sense, right? With even less access to hospital care, what do we do? What can we do? What we can do is we can see these hospital closures as an opportunity to reevaluate, rethink where we choose to give birth, because it is a choice that we're making. It's time for us to explore different facilities or settings for birth. For far too long, we've held on to the image of a cold, pale, equipment-filled hospital room as the ideal place for birth. And I'm here to let you know today, 2024, that you have options, girl. Remember, it's your baby, your body, your birth. You can give birth in a place that makes sense based on evidence and research. Well, what makes sense based on evidence and research? Evidence and research show that birthing centers have better rates of successful, intervention-free childbirth than hospitals, okay? So let's look at how birth centers are able to achieve these better outcomes. First off, let's start with the basics. What is a birth center? A birth center is two things, okay? One, it is a place, it's an actual building that is specifically designed for birthing moms and their families. And then two, a birth center is a model of care. So the way that care is given and all of the procedures that come out of the belief system. And that is what's behind that model of care, okay? Now, as patients or non-healthcare providers, we don't think too much about models of care or the systems of healthcare that determine the care that we receive. We just get the care. But the fact is, different facilities have different models of care. So I want you to think about it like types of restaurants, right? There's fast food restaurants where the goal is to get you your food as quickly as possible so you can go and continue on with your day. And then there's fine dining restaurants, right? And the goal there is to provide you a high quality experience, from the food to the service to the overall ambiance, okay? We're paying for experience. We're gonna sit down, we're gonna take our time, we're gonna savor. Well, just like those two restaurants are different, hospitals and birth centers have different models of care, right? Hospitals are designed for critically ill persons who need medical intervention to get their bodies to function as quote unquote normal. And they may include a maternity ward or labor and delivery department staffed by nurses and OBGYNs. Birth centers are healthcare facilities where the care model is the midwifery and wellness model. And we'll go a little bit more into that. They are freestanding, meaning they're not attached to any other facility. They're not next to a hospital or connected to a hospital. They stand alone. And they're guided by principles of prevention, sensitivity, safety, cost effectiveness, and appropriate medical intervention. Appropriate medical intervention, okay? Birth centers and the birth center model of care are a key component to ending the Black maternal health crisis. Representation and culturally affirming care, like when Black patients have Black doctors, we need, look, Black patients also need Black dollars, because we have to support our own and we have to build our own. Because one thing for certain is we can't continue to go to people who have mistreated us and expect for their treatment to change, okay? That doesn't make any sense. But what I was referring to is culturally affirming care. That's when Black patients have Black doctors, okay? And that is helpful, but it's only helpful to some degree. Oh my gosh, Akila, why would you say that, right? Representation matters. We need a seat at the table. Maybe not, okay? Not when the table is broken. When the table is broken, why do we want a seat there? But I digress, okay? So now we all just saw last month, a couple of weeks ago, matter of fact, Dr. Jackie from Married to Medicine, right? We saw that we heard that she made some insensitive comments, harmful comments actually, about Black women, quote unquote, crying wolf to get out of work. Now, the unfortunate reality is that some Black professionals take on the dominant mindset and its biases in order to excel in the environments in which they work. And keep in mind, they still have to operate within their facility's model of care. So representation is not the full solution to the problem. Is it a part of it? Yes. Yes, it is. Is it the full solution? No. So instead of us trying to keep fitting a square peg in a round hole, we can actually put the square peg in the square hole, because that makes sense, right? Hospital births should be reserved for mamas with medical conditions. Mommies without medical conditions should strongly consider receiving care and birthing at a birth center. Even some moms with well-managed medical conditions can receive their care at a birth center. You simply have to have a risk assessment by the midwives, and they will determine whether or not you're a fit for you to receive care there. Now, you might be wondering, well, if it's a maternal health crisis, it's nationwide, the crisis is everywhere, how are birth centers any different? How are they able to achieve better outcomes than hospitals? Well, the answer is simple. They have a unique model of care that's different from a hospital, okay? Birth centers provide mom-centered services that work to meet the physical, emotional, socioeconomic, informational, and medical needs of each individual client, okay? So basically, they're about treating the person as a whole person and addressing any and all issues that the person may have that actually affect the pregnancy. Because at the end of the day, pregnancy is just a part of your health journey anyway, okay? So if you come to pregnancy, if you begin your pregnancy in poor health, right, then 9 times out of 10, you're more likely to have some type of complication. You may need some medical intervention. So it's important that as we address the maternal health crisis and as we offer pregnancy care and as we receive pregnancy care, that we're also receiving whole care, holistic care that addresses all of the issues that we have, okay? Birth centers support birth as a normal life event. They promote self-care, family engagement, and the mama-baby pair, meaning there's little to no separation between the two after birth. Mama stays with baby, baby stays with mama. Birth centers focus on education, health promotion, and disease prevention. They respect the human dignity of each mom and each baby, and they respect cultural diversity. Birth centers also encourage and facilitate a shared decision-making process for all their pregnancy, birth, and newborn care services. That means no coercion. They're not going to put you in the circle like some facilities do. Hint, hint. When you get put in the circle, you say, oh, I'm not interested, or I want to decline this procedure. And then before you know it, you have 3 to 5 doctors in your room telling you all the reasons why you shouldn't decline the procedure, okay? So they don't do coercion at birth centers, okay? And you will not be in the dark about what's happening. Birth centers are they do a really good job at educating patients, their clients, on what happens to the body during pregnancy, what happens during birth, so that you're armed with knowledge, you're empowered, right? You're educated to make better decisions and to also make a shared decision in your healthcare process. Because at the end of the day, that's that midwife's job, right? That may be her passion, that may be her love. Same thing with an OBGYN. That's that OBGYN's passion, that's their love. However, this is your body. Like, you have to live with the consequences of the health choices that you make. So you want to be able to have a voice in those decisions. You want to be educated enough so that you can make an informed decision, right? Because there's no point in you making an ignorant decision. So they really do a really good job at educating their clients, okay? Now, let me be clear. All of the above that I mentioned is the standard care at a birth center. So this is not like a platinum package, or this is not like the VIP experience. This is the minimum at a birth center, okay? Because this is their model of care. This is their system out of which their procedures come. You can increase your chances of receiving personalized, evidence-based care simply by making the choice to go to a facility whose services and systems align with your desires for your birth experience, okay? Now, for a closer look at the choices that you have available to you for providers and facilities, you can buy the Black Girl's Guide to Surviving Pregnancy at kiamawellness.org/guide. I updated the link, got rid of the QBWC, so it's much easier to remember. kiamawellness.org/guide, okay? To help us continue our efforts to educate and empower mamas and resolve this health crisis, please donate what you can at kiamawellness.org/donate. Remember, it's your baby, it's your body, it's your birth. Until next time, peace.